Are you solving hundreds of MRCOG Part 2 MCQs and still getting stuck in the exam? Do EMQs confuse you, especially when options look similar? Hi everyone, I am Dr. Sana Ansari. In this video, I'll show you exactly how to approach these MCQs, EMQs and even new unseen questions. So you don't just study more, but you actually score more. Now first, let's understand the exam. MRCOG Part 2 is not a memory test. It's a test of clinical thinking with pattern recognition. You will see two types of questions, single best answer MCQs and extended matching questions. Any of these questions fall into three categories. They are either recall based or modified recall, or there is a completely new scenario. Your strategy must cover all these three types. Now first, let's understand how to approach single best answer MCQs. So whenever you are reading an MCQ, the first step is always to read the last line first. It tells you what the examiner wants: diagnosis, next step or best investigation. Now second step is identifying the important clues. For example, look for the age of the patient, period of gestation, symptoms and red flag signs. Step number 3 is you eliminate the wrong options. Remove unsafe options, outdated management and irrelevant choices. Now fourth step is think guideline based. If you get confused, ask what is the safest step, what comes next. Now fifth step is don't overthink. If you know it, answer it. If not, mark and move. Let's take an example. A 30-year-old primary gravida, 34 weeks period of gestation, presented with headache, visual disturbance with a BP of 170 by 110 and 3+ proteinuria. Now the question is, what is the next best step? Option A is oral labetalol, B is immediate delivery, C Maxil, D is repeat BP in 4 hours and E is CTG monitoring. Now how will you solve this question? First, look for the important clues. This is a severe hypertension, BP is 170 by 110 with neurological symptoms and 3+ proteinuria. So this is a case of severe preeclampsia. Now check what is being asked. Here the question is about the next step. Now you start eliminating the wrong options. Repeat BP, CTG and oral labetalol. These are obviously not coming in the next step for severe preeclampsia. Now confusion is between Maxil versus delivery. So answer here is magnesium sulfate, because in the case of severe preeclampsia, you always stabilize first, then you prevent seizure and then deliver. So MRCOG tests the sequence, not just diagnosis. So this was about how to approach single best answer MCQs. Now let's come to recall MCQs. These are useful but only if used correctly. Just for an example, there is a case of postmenopausal bleeding and they're asking about best initial investigation. So the wrong approach would be that you memorized it and the answer is transvaginal scan. The correct approach is you understand the whole pathway of postmenopausal bleeding. The first line is always transvaginal scan. If endometrium is more than 4 mm, then you go for biopsy. So for one recall question, you revise the whole topic, because questions can change also. Now let's understand how to approach extended matching questions. EMQs, although they look difficult, but they're actually scoring if approached correctly. So what I used to do for EMQs, I used to read the whole scenario carefully and think of the answer before looking at the options, because options usually confuse you. Let's look at this EMQ example. The options given are bacterial vaginosis, vulvovaginal candidiasis, trichomoniasis, chlamydia and gonorrhea. Now they are given the scenarios. First scenario is thin greyish discharge with fishy odor. Second scenario is thick curdy white discharge with itching. Third is frothy greenish discharge with strawberry cervix. Now you have to solve this using a strategy. After reading the scenarios, you should have the correct option in the mind without even looking at the options. So the first scenario is about the greyish white discharge. Answer is A, bacterial vaginosis. Second scenario is about curdy white discharge with itching. So the answer is candidiasis. Third scenario is frothy discharge with strawberry cervix. So the answer is trichomoniasis. Now coming to the new questions. This is where most students panic, but this is where rankers perform. So the strategy is go back to the basic, always think of the safety first. In OBS case, always think of mother's safety, then fetus. Now let's take an example. A woman collapses immediately after delivery with heavy bleeding. What is the first step? Option A is blood transfusion, B uterine massage, C hysterectomy, D IV antibiotics, E CT scan. Now when you're reading this question, the important clue here is PPH. What are they asking about? The first step. So answer here will be blood transfusion, because immediate action in a case of PPH is resuscitation. Now what all to study to practice these MCQ and EMQs? Keep it simple and focused. Do past recall, at least of the last 3 to 5 years. Do one MCQ bank. Some options I have mentioned in the description. Always focus on the high yield areas like CTG, PPH, preeclampsia, early pregnancy, contraception, labor ward scenarios. Avoid multiple resources, passive reading. Always remember 3 things. Don't memorize, always understand. Think before seeing the options and focus on sequence of management. Then even new questions will start feeling familiar. If this video helped you, like, share and subscribe, and comment below what problems you are facing for MRCOG Part 2 preparation. Thank you.